Welcome to Idea Talks. During these episodes, we are meeting with managers, CEOs, entrepreneurs to understand better their way of leadership and their views on management. For this episode, we're meeting Mr. Jorgen Souness, who is the CEO at St Vincent de Paul.
Malta's future starts with a conversation. Idea Talks.
Mr. Souness, thank you for your time. And before we start, in a nutshell, perhaps you could give us your background and why you chose this field specifically.
I'm a nurse by profession for the past 20 years, basically. Currently, I'm working as a CEO at St Vincent de Paul.
You've been in this role for how long?
For 2.5 years now.
Okay.
By a nurse, I have been 20 years. I've been the first 6 years working in the acute hospital in the medical ward. Following that, another 5 years working still in the acute hospital via an outreach team where we took care of patients both in the community and at the acute hospital. And now I'm taking care of St Vincent de Paul alongside my team.
And you used to work as a nurse at St Vincent de Paul or?
No, at St Vincent de Paul, I was a student nurse, basically. Okay. I was a nurse. I only worked as a nurse at Mater Dei, at the acute hospital. Then, following the medical ward and the outreach services, I was assigned the COVID vaccination system, the COVID vaccination campaign, and then I was transferred and was transited to Paula Hub to take care of the operational phase before it actually opened up the doors.
So when you were a student at St Vincent de Paul, did you ever think that one day you'll be the CEO of that hospital?
I never imagined being the charge nurse when I was still a student. You know, that's the dream of every nurse. Ramping up the hierarchy of nursing, I never imagined I'd be the CEO of that hospital, basically. And things changed a lot from when I was a student, when it was just a long-term care residence, to a fully fledged, we can say a fully fledged hospital nowadays at St Vincent de Paul.
Who are you at heart, nurse or CEO?
At heart, I'm a nurse, fortunately, but I'm a CEO by profession.
You mentioned COVID. It was unprecedented. There was no playbook. It was a first for everyone globally. Was there a moment during that period, that very difficult period, when you thought, or you asked yourself the question, how are we going to get through this?
Yes, COVID-19 basically was bad times for everyone, even international, not just a local problem. That pandemic lasted for approximately 2 years, both nationwide and international. And everyone questioned himself, how shall we go about it? Whether we shall recover from this period. But times change a lot. Times make you learn new challenges in life and adjust your professional experience, your professional even values according to that time frame in life. But yes, it was a challenging time for the healthcare system in Malta, but thanks to the communication via local experts, via doctors, via all the multidisciplinary team persons that work in the acute hospital and even worked in the elderly home setup, we managed to go through it both peacefully and even successfully, because we were the first country, the first nation that managed to vaccinate the higher number of patient per capita. So yes, it was a success rate as well.
From that period, what's one leadership lesson that you take away?
Basically, yes, rather than being a democratic at that phase, because democratic is my favorite type of leadership, which I actually implement, you need to be transformational. You need to implement new changes in the healthcare system, changes that you never dreamt of being implemented. And the most important lesson learned is by communicating with all stakeholders, not just with the healthcare professionals. We had strategists, we had academics on board as well that managed to help us build up the strategy for this vaccination campaign. But yes, we managed it.
By nature, are healthcare professionals resistant to change?
That's the study that I'm currently pursuing, basically. There are, yes, healthcare workers.
When you say study, where are you pursuing?
I'm doing this study I'm doing the DBA
Okay, which
Today
is the doctorate for business administration, right?
Exactly. And I focusing on digitalization in the healthcare field, basically. Yes, you have enablers, you have barriers for this change, both in technology and even other changes in the healthcare field. You'll have healthcare professionals that are not, they are resistant to change, but by proper communication, by proper feedback taken from them, I think we will overcome this barrier thing, the famous that you find barriers in implementing certain strategies in certain particular hospital, for example. But by referring to studies nowadays, thanks to the internet, we can look up academic researches, we can even liaise with foreign hospitals that implemented such change before us. I believe that such barriers might be even turned up to enablers. So,
in the healthcare sector, especially in your area, we rely a lot on third country nationals. Okay. On the one side, people say if it wasn't for them being here, we would have a huge problem with regards to lack of human resources. But on the other hand, it does have its challenges. For instance, communication, especially with the elderly people, because, of course, third country nationals, the absolute majority of them do not understand and do not speak Maltese. And for most of them, even communicating in English is an issue at times. And you're the CEO of the largest hospital for the elderly in Malta. So you face this challenge every day. Talk to me about it.
Like exactly as you said, 2/3 of my healthcare professionals at St Vincent de Paul, they are foreigners. Most of them come from third country places like Nigeria, and we have even Asia. But this all focus on, like you exactly said, proper communication channels. We are giving courses, Maltese, basic Maltese for these third country nationals, for these foreigners, so that they can engage themselves better when speaking with the residents. As you know, the residents at St Vincent de Paul, like just any other elderly home, are all above 60 years of age. That means that their culture, way back, when we're speaking about way back, when they were juveniles, 30 years of age, 20 years of age, the culture was different in Malta. So we need to engage with them and speak about their behavior and the culture, how Malta was about 40, 50 years ago. So we are giving them even cultural training, how the Maltese nation shifted from way back, when even during war times. We explain to them how Malta, the history of Malta, so that when they are taking care of these patients at St Vincent de Paul and even in the other hospitals, not just St Vincent de Paul, they are aware how our locals, how our geriatric people pass through their life. So we are trying to engage through these courses, basic medical Maltese, cultural transformational courses, so that they are more feasible, they are more at ease when talking to our geriatric patients.
How do you get a good grasp of what's happening within the hospital? Do you rely on what your people tell you, on what managers report back to you, or do you walk the wards to get a better grasp of what's happening on the ground?
Like they say, you need to walk the path with them to understand better what is happening. We have a hierarchy at SVP, just like any other governmental entity and even private entities. Above this, below the CEO, there are the directors. Mind me, we don't refer to below above. We refer to us as colleagues.
Okay.
Directors, nurses, cleaners, we are all colleagues working together there. All right, the CEO is the topmost part of the hierarchy, but that doesn't mean that you sit there and you just give orders. You need to assess, evaluate, get feedback from the end users, the ones that are liaising directly with they have hands-on with the patients. We have the managers, we have the charge nurses. The nurses consist of around 2,500 around SVP, so that's the largest workforce that I have. But I try my best to at least 3 times in a year, I go around the world speaking with them. And even every quarterly, we hold meetings between middle management and top management top management more often for obvious reasons. And we try to get feedback to get grasp of the situation that is currently being, implemented across the hospital.
We are an aging population, so I presume there is a sizable waiting list of elderly people who are waiting to get into St Vincent de Paul. I guess that's a big headache. How do you deal with it?
Yes, unfortunately, trying to assess patients to the ideal home they need to go. It's a big headache, yes. First of all, the transit of the elderly from the community setting to the hospital. But thanks to my colleagues as well, we managed to implement a tool where we assess the patients accordingly. So, patient that is admitted at SVP, we call him resident rather than a patient. That resident needs to be assessed by a team of professionals to see his medical condition, the needs, and whether the community homes in the community out there can cater for his needs. If not, he then or she will be assigned and transferred to St Vincent de Paul. Please note that St Vincent de Paul is not just an elderly residence. We are transforming into a hospital, like we already said. We have around 40 beds currently being piloted as intermediate care.
Okay. Which means?
Which will pave the way for the bigger hospital in the coming years. Intermediate care is the process, is the part where the acute hospital, a patient is discharged from the acute hospital, but is not yet fit to go to the community, back to his home, or else the elderly home where we used to currently live. So this intermediate care process, a patient is admitted there, rather than being admitted in the acute setting. It's called a step-down care or a step-up care.
For rehabilitation, I guess?
For rehabilitation, yes, that's one. Step-up care means from the community to this ward directly. Okay. He is admitted there or she is admitted there. A team of professionals, geriatricians, nurses, allies, all professionals, work together coherently so that they can give the best care for the patient, assess the patient, and when he's fit, he is discharged back home. Then there is the step-down process. A patient is admitted to the acute hospital, where he needs acute care, which we cannot provide at SVP, and then when he is stable to a point that he can be discharged back to intermediate core hospital, the patient is shifted from the acute hospital from Mater Dei to St Vincent de Paul for the rehab phase, like you just said.
Okay. So being CEO of such a large hospital with so many employees and so many residents, I'm sure that it's a very stressful job. How do you unwind?
My hobbies are playing with my dog and my kids. I have 2 small kids. And after work, although the role of a CEO is quite hectic, basically, because you cannot go home, switch off the laptop, switch off your mobile and say, that's it. No, it's 24/7, basically. If something happens during the night, you keep thinking if something happens to your patients, your relative, to your staff, because the staff are the most important key persons in that hospital. I go home after a day of work. I go home, close a bit the laptop for that just an hour, play with my kids, take them to the private lessons or else to the ground football, and play a bit with our dog as well as part of a family therapy we do every day. But then, unfortunately, I have to switch on the laptop again before going to sleep at around 9-10 o'clock, do that hour and 2 hours of time focusing on the important things that happen during the day so that, as you say, you don't leave any stone unturned, and then prepare for the next day, which is quite challenging every day.
So a 20-year-old comes up to you and tells you, Mr. Souness, I heard this interview. I am seriously thinking of becoming a nurse. What's your advice?
Yes, nurse, it's rather than just a profession, it's a devotion. You need to be committed to work as a nurse. You need to have the patient at the center of all your decisions, like we refer to as always, everyday patient-centered care. Like I said, nurse, I worked in the acute hospital. I worked with young children. I worked with middle-aged persons and even with geriatric. Yes, I will tell him, go ahead.
You recommend it?
Yes, a lot. A nurse in Malta, the satisfaction, job satisfaction, when you go to work after a full day of hectic, patients calling, medical treatment, waiting for the patients. You need to give handover. In case of a resuscitation, you need to see the communication, the workforce joining together to provide that type of treatment. But after a day of work, you say, listen, today I managed to save a life or 2. So yes, it's very rewarding.
This brings us an end to this first episode with Mr. Jorgen Souness. We shall be continuing this conversation in our second episode with the CEO of St Vincent de Paul.